People email me or call me and tell me that their gums are bleeding. And they ask, what does that mean? What do their bleeding gums mean? Bleeding gums mean that you have gingival inflammation. And gingival inflammation is commonly referred to as gingivitis. Let me show you clinically what that means in the mouth.
Okay, here are some of the classical signs of gingivitis. Notice the red and puffy gums that we have along the teeth here. When the gums swell up like that, it's an indication that there's bacteria underneath. And that bacteria ulcerates the tissue under these puffy gums. Now, another classic sign of gingivitis is that when we take a periodontal probe, this instrument here, which measures the depth of the pocketing around each tooth, when we probe to measure the depth, you'll notice that the gums will bleed because the tissue is ulcerated from the bacteria growing under the puffy gums. And the patient will feel a little bit of discomfort. These are classic signs of gingivitis, gingival inflammation underneath the puffy gums. And what this patient will need is a thorough cleaning of the bacteria out from around each individual tooth, and then this puffy gum tissue will then shrink up, become more healthy, and the next time we probe her, she won't have any bleeding upon probing because the ulcerations would have been cured and healed.
We had just seen a case of gingivitis in the mouth where we probed the tissue and the pocket depth of the periodontal probe is limited by the bone underneath. And if you peel the gums back off the teeth where you had gingivitis, you can see that the perioprobe was hitting the bone level here, limiting how far this probe can go down, therefore having minimal pocket depth. Now sometimes when we probe and measure the pocket depth, the periodontal probe goes in much deeper, and the pockets are significantly greater than we find during gingivitis. If we peel back the gum off the bone, we see this situation where the bone has eroded away by a disease process called periodontitis. So instead of having gingival inflammation as gingivitis, we now have gingival inflammation progressing to the next level of periodontitis with associated bone loss. This is a more advanced periodontal disease state and must be addressed immediately by a periodontist. Now that you know that bleeding gums is a form of periodontal disease, you should also know that periodontal disease is the leading cause of tooth loss. But what most people don't realize is that periodontal disease is also associated with diabetes, heart disease, kidney disease, arthritis, and certain forms of cancer. Okay, you've just seen the difference between gingivitis and periodontitis. If you have bleeding gums, please don't ignore it. Give us a call and visit our website at kirpusdentistry.com. And if you want, we can set you up immediately with a consultation with our periodontist, our gum specialist. So please pick up the phone and do something about it. Call us today.